Hey guys, so really quick 4-month post-op video. I debated not making this video because I don't really have a lot to say and I don't want to be one of those people who just posts for the sake of it. But I did have a couple points on the scar treatment I'm using, a few new things I'm doing that I thought might be worth mentioning, and then also I guess just for consistency, doing one of these videos every month is kind of nice. So I'll show you my chest. It looks pretty good. Like, I really can't say that much has changed in the past couple months. I'll come in a little bit. So the nipples, I'm really blessed that both of my nipples project. I don't have a lot of feeling in them aside from just tactile feeling. They're really soft, and I think that's a result of using rosehip oil on them from time to time, just to kind of prevent them from drying out, because every once in a while you do see guys who have, it almost looks like cracked nipples. Like, you can see the graft was there, but it's almost like fragmented, and you can kind of see like cracks in it. And I've read that that's from, the skin just really drying out. So you don't want to be putting oil on all the time, because that can also damage the skin and cause it to become macerated where it never has a chance to dry out. But from time to time, using the rosehip oil when it comes with a dropper, so just like 1 or 2 drops, like before bed or something where you have an opportunity to shower it off in the morning, I think can be really beneficial. So don't go overboard, but I think it can be good. Aside from that, I don't really have much else to say about the appearance of my chest. Everything is still pretty thin. The scars, like I said, haven't really stretched. My range of motion, I think, is better. I'm still not pushing myself on reaching, but I don't feel any like pain or pulling if I do have to reach something, so I think that's good. There's different opinions on range of motion and whether you should kind of push yourself to regain range of motion. Some people really limit it for an entire year post-op to minimize stretching. I've kind of been in the middle, like I've been going by feel. So if I feel like I can reach something and it's not pulling or anything, I'll do it. I'll be careful and mindful of it. But I think it is important to have a little bit of that range of motion so that you don't limit yourself, meaning that the scar doesn't form to the point where it's binding the skin and not allowing your body to move in the way it's supposed to. So it's kind of a fine line, and it's really difficult to find an answer on what's best. So I think with most things, if you're listening to your body, you're probably doing what's best. Like, obviously, if it hurts, don't do it. If you feel stretching or pulling, you should probably stop, and just don't overdo it. But I think it's okay to kind of test that range of motion a little bit, especially more as the months progress in your recovery. The only other big thing I was going to talk about in this video was scar treatment. So I'm still using the silicone strips. I have mixed opinions on leaving them on for longer than 24 hours because I feel like I have, especially in this area, like a lot of irritation around the scar. It's not stretching, but you can see like all these little bumps. And I think that might be from having the strips on for the entire time and not taking them off to shower and things like that. So I think in this next week, I'm going to play around with only wearing them during the day, taking them off at nighttime, letting the skin breathe a bit, and then after a shower in the morning, putting them on and see if any of that clears up, just to kind of play around. And if it doesn't, I might even see a dermatologist because I'm a little bit concerned that the skin isn't reacting very well to something that I'm doing. So I was using Mepiform, which I'm a huge proponent of. They're really good, especially in the beginning of your recovery. I would definitely recommend using these. They adhere really well and they don't hurt when you take them off. Like, they're sticky, but they're not overly sticky where they're gonna mess up the skin. They come in a sheet. This is a bulk pack, so you get 5 sheets. It's a little bit cheaper because it's wholesale. It comes in a big sheet like this, so it's 4 by 7 inches. I get a measuring tape and cut about 3/4 inch strips, and my scars are just over 7 inches, so it just about fits So I was using those for just over 3 months, and then in the past 2 weeks, I switched to ScarAway, which I had 1 box, and I actually just ordered some more. So these are good for a few reasons. One, I think they're slightly more durable than these, meaning even if you take them on and off every day, I think they last longer than the Mepiform. They're also a little bit cheaper, but I think the main thing I like about them is that they're really, really sticky, and they stay on when you're at the gym, and they just, I don't know, they move better with the body, like they contour the body better. And they come in these 3-inch strips, so they're 3 inches by 1.5. So if you cut them in half, you don't have to measure anything. You know that cut in half, they're 6 inches long by 3/4 inches, which is a really good fit for most people. You might have to do a little bit more if your scars are longer like mine, but I like them a lot. So they are my preferred brand, but again, in the beginning of recovery, I would recommend Mepiform. I think it's going to work better because it's good on that sensitive skin. Aside from that, my scars are still kind of red, and I know, or pinkish, I guess, and I know it's still early because they can take up to, I've heard up to a year, but I've heard also like up to 1.5 years, 2 years. So basically after 2 years, they're not really going to fade anymore. So I know 4 months is early, but I'm kind of impatient and I want them to fade faster. So I was doing some research to see what else might work as far as natural remedies, aside from just the silicone strips and the different oils I'm using. And apparently lemon juice has AHA in it, which is like I don't remember what it stands for, some kind of acid, and it's a natural bleaching agent. So carefully and like read instructions online on it, but you can use it on your scars to help reduce the pigmentation. So I did that today for the first time. I just bought an organic lemon, cut it in half, squeezed it to get the juice, rather than getting one of the like lemon concentrate juice things. Isn't going to be as good quality. So you get it with a cotton ball and just kind of dab it on both sides, leave it for 10 minutes, and then rinse it off. So it's my first day doing that, and I'm planning on doing it maybe not every day because my skin's very sensitive, so I'm going to try just a couple times a week, and if my skin seems okay with it, I might try a little bit more frequently. So that's pretty much all I have to say. This video ended up being a little longer than I thought, but that's alright. If you guys have any questions or want to know anything else, or maybe have scar advice for me, that would be fantastic. I'm very open to it. But yeah, that's it. This is my 4 months post-op. So thanks for watching.